Hello. Good afternoon, everyone. We're so very happy to see you today. Welcome to the second in our clinical education webinar series. I'm Alice Nelsner, and I'm the CEO of the San Bernardino County Medical Society. And we are very excited to be presenting this 12-session series in partnership with Riverside County Medical Association and IEHP, Inland Empire Health Plan. SBCMS is happy to present this today through our offices, and our topic today is vaccine hesitancy and overcoming patients' apprehension. We have a fabulous speaker whom many of you know, Ilan Shapiro, MD, whom we will be introducing in just a quick moment. Just a couple of quick housekeeping items. If you would be so kind as to keep yourself on mute unless you are going to speak. And Dr. Shapiro is going to graciously take questions from the audience. So if you can enter those in the chat as he goes along throughout his presentation, that would be wonderful. And you can also, I apologize, there's a plane overhead. You can also raise your hand at the conclusion of his remarks, and we can interact that way as well. So thank you all so much again for joining, and I'm going to introduce our speaker now.
Thank you so much for the opportunity, and I'm very excited to be with everybody. And
let me introduce you officially here, Dr.
Perfect.
Shapiro. I'm so sorry. That's my fault. I just want to give you all your cred because you're amazing. Dr. Ilan Shapiro is the Senior Vice President and Chief Health Correspondent and Medical Affairs Officer for AltaMed Health Services. He supports strategies for external health communications, advocacy, and community relations. As the Chief Health Correspondent for AltaMed, Dr. Shapiro works closely with the Public Affairs, Community Affairs, Government Relations, and Civic Engagement departments to help expand community health and wellness initiatives. Dr. Shapiro has been with AltaMed since 2016, and he's made a significant impact on the organization and the greater communities it serves. As many of you know, he's a tireless advocate for healthcare equality with a deep affinity for innovation and public health policy, especially relating to the Latino population. And I just want to add that many of you are aware of this, but Dr. Shapiro has been such a steadfast leader and role model in the vaccination and public health space with regard to founding so many community initiatives, one of which was Vacunate Ya, the sister organization to This Is Our Shot. And that really assumed prominence in 2020. Dr. Shapiro has established himself nationally as a spokesperson in health issues and especially in the vaccination space. So Dr. Shapiro, now we are very excited to officially welcome you. Thank you.
Thank you, Alison. And whenever you send me the signal, you know that I will always be here. Thank you, everybody, for actually being here. I know that it's the middle of the day. We have a busy everything. It has been a very interesting 2025, but I promise you 2027 will be amazing. Then there's some hope there. There's like some light over there. I want to just share that I'm Ilan Shapiro. Please, I do have the chat open here. Then feel free to actually put the questions here. And the first question that I'm going to actually ask you is, where do you work? I know that you're the area, but where are you coming from? That will be awesome. And if you're a doctor, a nurse, or a practicing physician, whatever, if you can put it over there, I will really appreciate that part. Then I'm going to start Ilan Shapiro, Pete's MD. Then AltaMed. That way I can start giving headaches over there. Then today my idea is actually to start having the conversation on why this is happening. Why are we having headaches? Is this new? Are we going to get better? Did we learn something with whatever COVID whatever happened during 2020, is there any scars left? And most importantly, if there's any, very importantly, tools that we can use as physicians to move this forward, because there will be a lot of learnings. Don't expect that you're going to finish this type of conversation and you're going to be an expert. No, but I will give you enough confidence to start a different way and a route. And it's kind of a menu on how we should be talking with our patients. And the beautiful part about this is that you can use the same model to talk about most of everything that is sometimes hard to talk with our patients or our community. Then let's start with that. I always give respect to my wife. She's my ex-boss, and it's not that she's my only wife, my first wife, and we are not divorced. And we're really, really good. But let me show you right now who actually is my team. That's my new bosses. Those are my two little kiddos, and we always need to kind of ground ourselves to things that we, on a shady day, a crazy day, a rainy day, or a happy day, like, why are we really here? And vaccines do relate a lot with the future of our communities, with the future of absolutely everything that we have. I'm going to showcase this part. You see a beautiful picture in front of you, and you have two ways to see life. You have the green side, and you have actually the dark side, that it's gloomy, dry, even though that there's a lot of clouds, there's no rain. And the other side is actually, happy. You have colors, you have even birds. That's where we are right now. We're in that middle road where, and as a background, I have practiced in other countries, and I have never seen polio, but I did see measles. I have seen, kids actually dying from influenza, Haemophilus type B. I have seen a lot of the stuff that we have not seen in the US. And I'm going to start with this, and maybe it will be controversial. The worst part of vaccines is that they actually work. They actually work. And the memory of having kids inside of those horrible metal things for months in order for them to breathe and actually survive, it's something that we don't have. The amount of kids that right now we do not have that actually had rubella and they were having hearing problems, vision problems, or cardiac problems when mom actually got it during pregnancy, that's something that we have like a minimal number, but it's not as much as we had before. Meningitis, like I can give you the entire list, but you get my point. There's an option and opportunity here. We all want to do the same thing for our kids and our patients. That's me with one of my young ones over there, 2-month-old, trying to actually check the ears, and he was actually very playful and didn't work out. But anyway, the important thing here is that we know that there are things that as physicians, if you're a pediatrician, internal medicine, med peds, family practice, any place that we are, there's things that we continue to do. We still love our white coat. Maybe we don't wear it every day, but we like it. And we use certain tools and ideas to move forward. Right now, the fabric of that peculiar thing called vaccines, it's slowly getting ripped. It's slowly getting ripped. And a lot of people are thinking that there's actually a man behind the curtain, and I don't know about you, but a lot of people actually will tell you, like, Doc, you probably are doing like millions of dollars on vaccines, and that's why you want to actually do that part. Like, and I do have interesting conversation about that I'm a community physician. Most of the private pediatricians are actually struggling to keep up because they end up paying more to have the vaccine that actually is not even cost neutral. It costs money to give vaccines, and it's not to the patient, but to us as physicians. Then in reality, there's not a lot of things. And also, right now, with all the changes that we're seeing in DC and other places, and what's happening right now in Texas, we clearly see the problems that we have. We clearly see the problems of misinformation. It's better to have hepatitis A. It's better to do, why not? Measles parties. Why not? Why not? What can be wrong about that? Then there's a lot of things that are happening right now that, they are combining, and we need to talk about this. It probably didn't help all the misinformation and disinformation that we had during COVID-19. And when I say this, is that probably all of us here have that feeling. We had questions regarding if it was too fast, the side effects, the profiles, why, if my DNA will change because I'm getting an mRNA vaccine. How do they work? Is it safe for my kids? And with all that part, fear plays a huge role on this, to the point that we are seeing right now things that we're not seeing before. We have more than, we're right now on the third month of 2025, and we already have more cases that we had in 2024. Then it's a wake-up call. Then yes, it probably started a lot with what we had before, with COVID-19, with that part, with misinformation, with should kids have it or not. And I'm going to be bluntly honest, we need to move forward. Right now, most of the vaccines that we have been that are way older than the COVID-19 vaccine, but we need to approach this because our patients are hearing a lot of things around our community. They are hearing about problems. They are hearing about confusing information. Should I get vaccinated or should I get vitamin A? Is it cod oil the best way to actually treat a lot of these viral things? Then, and of course, the real thing that we have in front of us is that it's hard. It's hard. And I'm not going to lie to you. It's sometimes actually hurts me a lot when I hear all this things happening around the community, where I hear that people, I'm afraid to ask if they want the COVID-19 or influenza vaccine. And I'm not afraid of actually asking. I'm afraid that a lot of people I know that the answer will be no, no matter what information I can bring to the table. That doesn't stop me for continuing doing it. That doesn't drain all my energy. But that's something that I have that little scar over there that, like, especially right now that we're seeing all the influenza that's happening. COVID has been kind of on the slow side, but still, it's sadly killing 1,000 people every week. Then it's still not a small problem that we dissipated, but we have things to make it better. We have opportunities to improve what we have. And that's why it's so important for you and all of us to be in this conversation. At the moment that we have, this information, and I'm sharing this one, or conflicted information, we know what's going to happen with our patients. They step back, fear starts, and it's not that they're hesitant or no. Our parents and our families and our adults and anybody in the community, we all want the same thing. We want to have a better life. We want to protect our kids, and we want to make sure that we're avoiding absolutely everything that we have in front of them that can harm them. Then if I'm hearing, well, the influenza shot doesn't work, I still can get a cold, then you start having all this weird informational things around our kiddos. And of course, it doesn't help. It just doesn't help. Why? Because when we get COVID-19 or influenza, and we're talking about, and by the way, I do feel that part of this is our own fault, because when you tell, and I'm guilty on this one also, when we tell our patients, well, you're going to get a flu shot, like, okay, is it the stomach flu? Is it the runny nose flu? Is it the headache flu? Is it just a fluke of destiny? Like, what the flu? Then that's the things that we have in front of us that we need to start correcting and checking our way that we're communicating also. Because if we're not telling them the truth, when we tell them the truth, we call it the flu shot, but it's the influenza vaccine. It's against one type of virus. It doesn't help you against all the cold and colds that we have and all the other infections and all the other list of 100 something viruses that we can get in winter. It's only for one, that it's one of the nastiest ones that we have and gives us a lot of headaches. Having the vaccine, and again, we were very optimistic with COVID-19 at the beginning where COVID-19 didn't mutate it and we were having good protection above 90 something percent. Then that thing gave us a lot of hope that we will be vanquishing COVID-19. But in reality, virus changed, vaccine, everything changed. Then a lot of the things that we have right now is making sure that we are establishing that balance with our patients. Mandates, feeling that are pressured, and we will see right now, and I'm going to start that in a couple of minutes. The structure of all these conversations, and my best advice to you, apart from the tools I'm going to give you, is that and my ego shatters with this, but bear with me. We need to present ourselves not as the judge, not as the goalkeeper, not as the referee, not as any of these things that actually have a lot of power around us. Because at the moment that we stop seeing that we are just a waiter, we're there to serve our community. We're part of the team. And one of the best things that actually helps me a lot and actually creates a nice conversation with my patients is that let me show you the menu. Think about me as a waiter. I'm going to show you the menu. I will show you what are the best dishes that we have, which ones I do recommend, which ones I love, and which ones are on sale. And I will give you all the spiel. And I understand as your waiter that you probably can have maybe some allergies, food preference, or simply you don't want to eat in my restaurant. And all of those choices are still good, but we're going to talk about it. If you choose something else, probably I will ask you why. The same way that if I am asking or showing you something from the menu, I'm going to tell you why I think this could be a good option for you. You heard me? Could be a good option for you. Right now, we need to start thinking about all these things, and we know that this is the thing that we need to do. We know that we need to have that conversation. But right now, we need to give a little bit back that energy for our familias, for our families, for the people that we take care of. That way they have a little bit more ownership because they deserve it. And that's where a lot of the things, and we're going to be starting to talk about this. This is actually from, and thank you, we were talking about this. This is your shot, vacúnate ya. This is a method that they kind of design around it. It's called the 353 method. And it's very fun. It's really interesting. And imagine that you're dating. And we're going to start the conversation like this. And please don't do this with your patients. It's illegal. But between us right now, we're dating. And we start, the conversation. If I come all, oh, you eat what I want. Oh, you do this. Oh, no, this is the best way. How are you going to feel? Weird, right? Something is not compatible. Something is not connecting. Repulsion. You're too cocky for me. I don't need that in my life. There could be a lot of other stuff in front of us that can actually give us a lot of headaches. Then I'm going to start with the 353 method. The first part is actually how to start the conversation. 5 is actually the key messages that we want to convey. And most importantly, how can we close that loop of communication? Then giving that example. And here's actually the part of the initial conversation. And I don't know about you, but I have had elderly in my family. My father, I have my father. And sometimes, they ask a rhetoric question and you go like, let me, and they already have the answer. their answer, not your answer, and it doesn't work. Or, for example, if your kids did something wrong, you go like, why you did this? And they're trying to explain what, and you start like giving your thing. Then the first thing is, if we're asking a question, we need to wait. We need to hear the answer. And for example, there's a couple of questions there. What do you think about the vaccine? Why do you feel that way? What concerns do you have about the vaccine? Open-ended question. There's zero judgment with them. And it brings us to a different place. It brings us to a place where you're welcoming them to your restaurant, asking them what they want to eat. And that's very important. The other part is create an alignment. And let me tell you why, because the same way when you go, you want to partner with someone that actually believes in you, that understands you, and you see mutual values. Then when you have that, and it's not, like if you have someone that actually clearly does not want something, it's not that you're going to, oh yeah, I don't want it either. Like, no, it's not about lying. It's about getting everybody aligned on the same conversation. Then the first thing is, and I give this example regarding COVID-19 vaccines. And for my kids, was I worried about them? Of course. I have never met a human being that would be not worried about any medical procedure that their kids will have. But I moved forward with information, balanced everything, saw the research, and chose what to do with it. And chose what to do with it. Right now, for example, a lot of parents actually need that part. They need to hear that it's okay to be scared. It's okay to have doubts. Yeah, and I always tell them, like I love when they come with questions. And I do get worried when they tell me a yes, doctor, yes, or a no, no, doctor, no, because there's no space there for conversations. Then that's one part. The other one is uh, align with the feeling that you want the best thing, and if you have a personal reason why you're doing it, it's very important. And also, find common goals. um why, and one for me, for example, right now that it's very close to my heart, is influenza and COVID-19. Why did I chose to vaccinate myself again and again and again and again and again and again, and probably again and again and again in the future? Because I do want to continue serving my community. Then if I get sick, and I do urgent care, I do pediatric care, then if I get sick, I cannot help them, I cannot be with my family, I cannot be happy, I cannot be healthy. Then at least having the vaccine, it's not that it will 100% take care of me, but it will have like a beautiful flexibility. It will have a better way for me to protect myself, a fighting chance to protect myself. And probably by numbers, one in every three people that are right now that we are here in the WebEx, um, Zoom, or whatever we're communicating right now, probably had influenza in the past 3 months. That's actually the number of patients. That's a huge number, to the point that we had a lot of hospitalizations. And the consistent thing that we had was that if you had the vaccine, maybe you will get sick, but most probably you will not end up with pneumonia in the hospital. You will not end up with ear infections. You will not end up suffering for a week because of influenza. Then having that conversation and finding common grounds actually works. And that actually gives the personal motivation of why I'm doing this. And again, I'm not selling a product. I'm not trying to convince them. I'm really trying to understand where they're coming from. And also, I want them to hear why I'm doing this, why I feel that this was something good for me, and that's why I'm recommending it. And right now that we're moving to the fifth part, it's actually getting the key messages out. And there's a couple of things that are very important and common to absolutely all vaccines. Vaccines are safe. And right now, and I'm going to give you an example regarding autism. Autism carries a lot of weight in our lives. We're having more. Give me 1 second. We're having my computer's doing funny stuff. I'm back. Um, our community actually needs to know about, yes, the autism rates are going up. We're having other issues with, is it safe or not? But the reality, and when you explain the basis of autism, where it started 2 decades ago, a doctor went rogue. He had tons of conflict of interest. He had a beautiful, amazing, quote unquote, research paper with 12 patients, and from that he extracted something that was not there. And also, he was doing a lawsuit on behalf of a different company. He was going and chasing his own vaccine. Then that's clearly not someone that didn't have any conflicts of interest. And also on the review, a lot of the information that he put on the article was on the research article was like not real. Then when patients actually hear that, and I didn't say anything else. And also I said 12. And if you compare it, for example, with what we know when we try to look for autism and vaccines, if there's any relationship, there has been ample studies of 1.2 million people, not 12, 1.2 million people trying to figure out if there's a relationship. There's nothing. 500,000 in a Danish research paper. Then feeling that we need to go again and again and again, probably we will, but at least it gives me enough comfort to tell that I'm not seeing their relationship. I'm not. And actually, a lot of the articles actually point out that, on the unvaccinated kids compared to the vaccinated kids, it seems that vaccines actually protect them a little bit more against autism. Most of them are actually leveled, it's the same rates, and some of them actually have that protective part of it. And a lot of patients go like, well, why is it happening? Well, first of all, I have no idea. Most of us have no idea, but I can tell you for sure that we're looking more for it. We have better tools to assess and also help the families that are having any type of developmental or neurological things that we can detect that when they're kids. Before, there was really nothing that we could do. Right now, there's therapies, OT, PT, a lot of things. And they go like, okay, doctor, but why are we giving more vaccines and autism is going up? Like, I completely understand where you're coming from, but there's a time correlation, yes, but it's saying that we have more cars than we have more autism. We have more pollution, we have more autism. We do not know, there's a time correlation, but right now that we have been trying to prove that if they are actually related, we haven't. And that's actually why I ended up vaccinated completely to date my kids with appropriate doses at the time that it was scheduled. And that's what I recommend. Then that's talking about the vaccines and keeping us safe. The other thing is we all hate feeling horrible. We all do that part. Then it's very important to right now to talk about side effects and be bluntly honest from the beginning. I tell them, like, for example, MMR, like your arm will hurt, it will be red, and give me 1 second because I forgot to the battery. Give me 1 second. 1 second, 1 second, 1 second. Okay, I hope that this is not working. Okay, I'm back. Okay, yes. I'm back. Sorry about that part. Then let me go back. Here we go. Sorry about that part. I forgot to actually plug my computer, my laptop, and we were going to have like a bad thing right now, but I'm back. Anyhow, saying that part, it's very important to actually make sure that we're telling them the real stuff about the pain. There will be redness, feeling a little bit of fever. Those are the most common ones, probably a rash 1 or 2 weeks afterwards. And be upfront with the side effects because they are looking for the 1 in a million, the stuff that we should not have. But it's important to actually do that part. The other thing is, beforehand, vaccines, we thought, you get vaccinated, you're covered against everything, is having like a life insurance, then that's that because you've got a life insurance, you will never die. Like, nah, that doesn't work like that way. But having a vaccine actually helps in certain ways. Then it reduces the possibility of complications, of actually spreading disease, making sure that other people are healthier. And also, as a parent, I really appreciate for me not to be sick. And also, if my kids get sick, it's time that I need to be with them instead of working or doing other stuff. Then no, I want my kids to be running and be worried about their math test and their social things, but not, a couple of weeks because they got, mumps. Then that's the things that we need to actually be talking with them. And also, what's the real data of what we have right now? And a lot of patients will talk about VERAS, the reporting, vaccine reporting, adverse effect reporting system. Um, and that's okay. And you tell them, I read that this system actually show whatever. Um, it's very important to tell that anybody can actually report that part. And actually during COVID-19, and this is actually a true story, you can actually Google it. Someone actually reported that when they got the COVID-19 vaccine, they became Hulk. I'm simmering this, and this is not a joke. This is actually the saddest part. It's actually not a joke. Then actually anybody can report, self-report, whatever they want there. And that's why we need to investigate, continue researching. And the last part is making sure that everybody knows that we are there for them. Do you have a question? Is something not clear from the stuff that I'm saying? Is there anything that I can actually improve on the way that I'm telling you this? Then get that feedback from them. And last part is the post conversation. These are the things that we should be opening the lines. And this is kind of, you dated, you went to the movies, you went to have a beautiful dinner, and you actually want his or her telephone number. Then what should you do? Is actually close the deal. And I'm going to give you an example, and here's actually some things that we used to do for COVID-19, but it actually applies to anything that we're doing right now. First of all, let them know that they have the choice. Let them know. And sometimes we feel that we need to be those leaders that need to tell them what to do in public health. Yes, we should advise them, but at the end of the day, it's their choice. And knowing that they have ownership and they have the possibility to choose takes away a lot of the weight on our patients and also on us. Because we can have an honest conversation, I'm here as a resource. I can give you more resource and everything else. And the other thing is, make sure that you're keeping the lines open. It's not that, well, you know what, I didn't get a kiss. They're going to run away. Like, no, like let me give you my number. Give me your number. Let's talk about this. Do you want to come another day? Do you need more information? Can I give you videos? Can I give you all these things can make a huge difference on the future of the way that we're doing things with our community. Then acknowledging that they have an option, acknowledging also that you're totally okay with whatever decision they make and you're willing to do that part. And the third one is make sure that you create an action. for us before for COVID-19 was actually go to my turn, you will actually get all the information, you can text, but this looks also for measles, like let's go to the CDC website, let's go to healthychildrens.org from the American Academy of Pediatrics. Let's give you some more information if you still need to do the research part of this. And also invite them. If they see something weird on the internet, TikTok, Instagram thing, or whatever, that you're there to continue the conversation. You're not going anywhere. And it's better that and be kind of open-hearted with this. Open your heart and tell them, I actually want to know. If you have a doubt or you saw something weird, let's talk about it. Maybe I will have the answer, maybe I won't. But if we don't have this conversation, your doctor becomes Instagram. Your doctor is Dr. Google, or right now ChatGPT. Then let's talk about it. You have doubts? That's why you have me. And there's a couple of things, very important things that you should remember always. There's a couple of things that poke your eye, poke your ear, and gives a lot of headaches. Right now, for example, injection, shot, jab really doesn't give you a lot of flexibility or happiness. On the other side, it's very important to understand that right now we were using the phrase safe and effective, and it still resonates with people that are in doubt because I don't want to inject my kid or myself with something that it's weird, that has been moving very, very fast. It doesn't work like that. And by the way, the same feeling they have for HPV vaccine, MMR vaccine, it's not just COVID. It actually pollinated. It started actually spreading around other things that we have around that part. Then we don't want that part. And the other thing is that it seems that we're more in tune about our close circle than talking about like herd immunity and stuff like that. You lose people, just lose people. Then talk about their families, about their kids, about their grandma visiting. That stuff actually helps a lot the conversation, and you have all that part. And also very important, especially right now, if you're going out there having conversation with your patients, with social media and media, it's important to understand that people will have questions. And that's the best way to classify anybody that is actually asking something about vaccines. Don't feel that you should move it or not move it, or it's not that they are anti-vaxxers or skeptical or resistant or has it. Tell it as it is. They have questions. That actually will make you feel better because you're not labeling something that it's scapegoating, you're anti-vaxxer or you're pro-vaxxer, or like, no, it steps down all the pressure that we have. And it's important to remind our patients about this, and I'm getting close to the last part of this. How safe are vaccines? Well, I will be way more concerned about sharks and actually harming us when we're actually swimming on the sea than actually having a problem with vaccines. And especially for those in Florida, the people that we have there, or actually in a lifetime, getting hit by actually a lightning is more common than actually having a bad outcome from a vaccine. Then saying that actually gives you a lot of flexibility and actually understanding, and it makes me feel better because that way I know that I'm not running away. I'm still doing the numbers. There's possibilities of our Guillain-Barré, allergies, all these things that can happen, but it's saying that, well, because I can get in a car and get in a car accident, then I should not drive. Then it clashes. Then I wanted to share that with you. And I'm going to finish with this. This is one of my favorite books ever, Alice in the Wonderland. And she's talking with a cat and she's having a conversation, and she's kind of lost. And the cat asks, well, where are you going? And Alice said, well, I have no idea. Well, that's your path. If you don't have no idea, well, we never will know where you're going. But right now, my family, we know that we need you. There's a clear correlation of us stepping up right now to make sure that we're not creating pockets of unvaccinated community members. We have seen right now what's happening in Texas, and right now we're above 300 cases, and it will continue to grow. It will continue to grow. And we need to be aware that we are that safety net. We are those trusted sources of information for our community. And again, we are the waiters. We're going to show them menu. We're going to show them what's the restaurant about, and they need to choose or not to do the things. But if they are not doing it because of misinformation or disinformation or fear, we have failed. We have failed because we were not on the table, we were not talking with them, we were not creating that linkage that we wanted them to actually have. Then we do need you. We completely need you. Last but not least, that's actually my real information. That's like, if you have your phone, just click on the QR code. You will find all the stuff, all the crazy stuff that I'm doing, and it's very important for all of us to continue this conversation. Follow the American Academy of Pediatrics; they have amazing stuff. Also, the American Family Practitioners Academy, they're amazing, and I'm actually butchering their name, but and we are there. We are there completely for you. And if we don't do it now, we'll actually start having more problems on the long term. We're going to have, um, right now it's measles, but after that, whooping cough can start actually even getting worse. And I I want them to be worried about, let's talk about football. Let's talk about soccer. Let's talk about the math class, but not about why they actually became blind because one of these infections. Saying that, Alison, I'm going to actually open the conversation right now with everybody, and I'm all yours.
Oopsie, sorry. Yeah, that was just amazing, Dr. Shapiro, which is not a surprise at all. Thank you. That was really, really engaging. I know there must be some questions. I'm not seeing any in the chat, but would anyone like to raise his or her hand and just ask verbally? Do you have any thoughts on your mind for Dr. Shapiro, since we've got him here? Or feel free to just speak up. I don't see any questions. Well, okay, I'll ask you one, Dr. Shapiro, and I certainly don't want to put you in the middle of any kind of a political discussion. That is not my goal here, because I know we're all trying to, tread lightly and figure things out while speaking up in the right sessions here. But what do you think about Robert Kennedy in his role, and do you foresee this as being an issue with trying to combat misinformation, or are you concerned with that? Or are you just going to keep doing what you do?
It's important to know that there's a lot of carrots and sticks involved with this. Right now, it's clear that vaccines actually are one of the best ways to protect our kids. No matter how you pitch it, no matter what you do, it's actually hundreds of millions of kids around the world that have actually been saved or actually avoided complications or even death because of vaccines. Then that one, it's clear. The other one, for example, is fluoride. We know that, can fluoride at larger doses can create stuff. It could. The thing is, for the amount of fluoride that we're using in water in other places, it's not that significant. And the way that we're using it, it doesn't absorb that well. Then it really doesn't create a lot of headaches. Then we have a lot of sticks there that we need to make sure that as physicians continue making sure that it's clear where is the line. There's a clear line there that and the other thing is that there's alternative treatments that we should be using and alternative treatments that we know that they don't work. And I'm going to give an example that at the beginning from the conversation. When you have, all these things that we're having with measles, we do not have a specific medication for it. We can use antibodies, we can use the vaccine to actually prevent the complications and further problems, but vitamin A, it's not one of those trusted sources of treatments that we have. Cod oil doesn't help to prevent or actually improve whatever's happening with the kiddos. And we have seen right now with the huge amount of hospitalization that we have had in Texas, it's real, and there's not much that we can do. Then making sure that we're creating that line. And I'm not telling you about pushback, but just like that's simply not true. These are the articles. These are the thing you can say that I'm from the other thing, or I'm being paid by pharma to whatever thing. But these are the numbers. These are the things that let's move forward. On the other side, I do believe that there's a good conversation to have regarding wellness, weight management, and mental health that can start it right now. I'm concerned because right now, if we take away Medicaid, that in the entire country takes care of 80 million people. And for children, it's about 37 million. In California, it's around 15 million people that actually depend on Medicaid. Then if we start pulling all these resources, what's going to happen? Well, less access to things, and can be a ripple effect, because supposedly we have the federal, we have pools of vaccines that could be free if needed, but it starts spiraling down, because if we cut Medicaid, that means less doctors, less nurses, less clinics, less rural hospitals, less community, we have a huge amount of things that start going against us. Then the opportunity here is to make sure that we are honest, that no matter if it's whoever is in DC, we need to continue bombarding our community, saying that we're here for them to answer any questions that they have, and calling it out if something is wrong.
That's great. That's really, really solid. And it sounds like you are really committed, to relying on the facts and the statistics and the information. And as long as we can keep presenting that, that's one of the best defenses to erroneous information that's out there, whether it's intended or not. Great. Thank you so much. Joseph Lee has a comment. Yes, please speak up for us here.
Hi, Joseph Lee here. It's a very insightful information, Allison. Thank you very much for putting it up there. My comment is, we know individual response to infection or vaccination different based on the age or condition of the body. For example, the young individual pediatric, they have infection or vaccination, they have very high peak of antibody, and then durability are very long. In contrast to somebody over age 60, they have a less peak, and then durability is short. And by estimate, about 30% of people in this country are in that kind of category, much more vulnerable to the infection or become very sick from it. I recently went around to UC Irvine nephrology that is measuring immunity level in chronic kidney disease, because CKD people has a very high incidence infection. The dialysis patient, they have during the pandemic, about 15% people die from those, and then their peak antibody and durability of the protection is very short. And I just wonder, I know Dr. Shapiro talked about pediatric population, which is a very standard, and then I think that's wonderful information to be aware of this. But I just wonder whether we should also focus on checking immunity level, check immunity level of the individual we are treating or those have questions about. In fact, I did a few tests for somebody high position in the Riverside, and this person had two vaccination. When I checked, this person's antibody was complete zero. So I called the person back right away and get booster after about 10 months, and then I repeated tests on this person. This person has very high antibody titer back then with the third force, but then in the interim, this person has infection, COVID, but wasn't very sick because of the protection by the antibody. So I just wonder whether we should also focus on how to measure immunity individual, and I'm very much concerned about people over the 60, those on dialysis, kidney transplant individual, or even worse than that, because there are multi-generation household, like Hispanic population, and then the kid could affect the grandpa, grandma, and likewise in the hospital or nursing home. Somebody's coughing, you can't really refuse to go to see this person, so you're exposed to it. So those work in the environment, maybe they need to be protected and with more measurement of the level of immunity, so that what is lacking is there is no precise information about the individual management of the immunity as to prevent sickness. You can't prevent infection, but prevent sickness, just like this person I mentioned before is a very leadership in Riverside County. So I just and the technology is feasible right now to measure the test. In fact, you just need one drop of blood. You can measure 250 antibody. You don't go to the hospital, go to ER, or go to a clinic. You don't need to. So this is something I just wonder whether maybe I don't know with Dr. Shapiro's. I'd like to see what you think about this. To your comment, and appreciate it.
Dr. Lee, I love the question because I was actually smiling because you blew my mind, because we have a couple of doctors and right now and they have been actually very close, that the titers for measles antibodies were below the ground, and they needed actually to get their the booster. Then it's true what you're saying. I do not have, would love to tell you that I have a evidence-based response for that part, but I hear you completely, that there's a good probability to figure out the incidence and prevalence of certain diseases and make sure that we are using that type of antibody typing at certain ages. The question would be, is it cost effective? Is it worth it? And if it makes a huge difference or not. I do not have the answers for that, but that should be something that we need to look for, because maybe we actually, even though that we're doing the influenza shot and the flu, the virus is actually changing, maybe we're good or not. I do not have an answer. You were noticing our patients with dialysis and other stuff. That I think that's a different, because they are so complicated, and the immune system it's very, very not well kept because of absolutely everything that they're feeling and happening. I think that they are in a different spectrum, but as a regular, normal, semi-healthy adult, with the common things of diabetes, hypertension, hyperlipidemia, and maybe I will sprinkle some problems with the liver, I think that it could be a good idea to do what you're proposing. Then we'd love to give you more evidence, but Dr. Lee, you left me homework.
No. I need to explain to you. I'm a nephrologist, but then I've been working with the UC Irvine vaccine R&D, Dr. Felkner, for the past about 3 years, and we have the publication we presented in annual dialysis conference last year, and there's a lot of information available. I think would really help individual. And what happened in dialysis unit, you have so much closeness in the deal with the patient and the nurses. So they both are very vulnerable. And then when you face about 15% mortality, it's just terrible. I think I don't know, but I would love to continue dialogue with you if you don't mind, or I can put my email address or the cell phone to you, and then I can give to Allison. You can provide to Dr. Shapiro. Then we'll be in touch. So I can send you the article we present in the annual dialysis conference, and basically tell the technology, and then we'll go from there. Yeah.
The answer is 100% yes. I already texted you on the chat, and there's my cell phone and my email.
Okay, I'm gonna give mine too. Yeah.
Perfect. Yeah, I send it directly to you. Any other questions? Anything else? Any other questions, concerns? Anything that I can help you with?
Do we have any other comments or questions, or have we hit the conclusion here? That we do thank you, Dr. Lee, for participating and bringing those issues up. If you do have any trouble reaching Dr. Shapiro, like you say, please feel free to reach out to me.
No. He already has my text.
You got it. You guys already took care of it directly.
He has my text.
Okay, that's wonderful.
Thank you so much.
Yeah,
Thanks so much
thank
for this.
you. Thank you. And Dr. Shapiro, we just want to thank you so much. I have to tell you, I got a text during the presentation, and I won't identify who sent it, but somebody said, wow, how did you get him to speak? He's really famous. And you are, and we really, you're on mute.
I'm actually right now blushing. Then what you were saying.
Yeah, I'm sure you hear that all the time, and you're kind of like a rock star. And somehow you came into our world, and you kind of class us up by presenting to us. So we really thank you for that. And we will be sharing this recording, as well as, with your permission, your slides, if that's okay, Dr. Shapiro. Okay, great. So we'll be sending that out along with the instructions for CME, if any of you as providers would like to apply for that. So that will go out the next day or so. And here's a code right now that Janice has displayed if you'd like to go ahead and access that now, but we will send it out by email. So Dr. Shapiro, thank you for joining us. And that was really special and educational. So we appreciate you, and we appreciate everyone being here. And please join us next month for our next session, which will be April 17th on allergy and immunology and primary care. All right. Thank you. Thank you. Goodbye.
Thank you. Bye.
Bye-bye.